Good morning and welcome to the latest and the newest show in town. This is Fact Check with me, Abel Omasete, from where we are going to analyze, break down, explain, and also try to come up with the possible solutions that affect you and me, the common Mwanainchi. And I'll be joined by my very able panelist, John Matava, who is a senior correspondent of Farmbiz Africa, as well as Alan Polycarp, who is a journalist as well as an analyst. Gentlemen, good morning and welcome to Fact Check. Now I'll begin with you, John Matava. Do you think that Kenyans were ready to deal with this pandemic, the COVID-19?
Abel, thank you so much for the time. In my take, I would say, first of all, Kenyans, they were not partially, I can say they were partially ready about how to combat the COVID-19 because so far we've seen always, every time when Mutahi Kagwe is on the desk addressing the nation on the matters to do with COVID-19, he's always blaming the Kenyans of ignorantly, they are ignoring the precautions as well as they're not taking measures set by the government. So I think most Kenyans, they are not ready in terms of combating the COVID-19, but with the recent education and people being taught how to combat it, I think now, as well as things are getting worse, I think everyone is now going to make sure that they put into measures to make sure that the COVID-19 is not going to go on as expected. So, Habel, I would say now, as currently, Kenyans are somehow ready, though not 100%, they are somehow ready how to fight this COVID-19.
Now, John Matava, allow me to bring in Alan. Alan Polycarp, do you think Kenyans were ready? Because before COVID-19 was declared a disaster here in the country, it was business as usual. It was all about BBA rallies. It was all about nobody can stop plague. It was all about locust invasion in different parts of the country. Do you think Kenyans were ready to handle this kind of pandemic? Alan.
Thank you for the platform. Let's say, per se, no Kenyan, nobody was ready, not even the Kenyans. Even if you check worldwide, it just hit people as a storm. Nobody was ready for this. And Kenya has a reputation of never being ready for anything. If you've checked on previous natural disasters, the rains, the floods, then the droughts, it's always the same story and the same story. Nobody is always ready about this. But I want to commend the government. I think the government took a few measures to be ready. Like you saw, they started setting up isolation centers and such things, and then trying to get the public to understand if this thing hits, what does it mean. But the citizens generally, I feel Kenyans have a laxity and they never really react to things with the urgency it's needed. So until when the first patient came in, that's when reality hit us. And even at that time, it didn't hit us that much. You were like, maybe it's just a passing storm, or the person just came in with it, but it didn't still hit people as serious as it is right now. Now, like at this point now, people are so informed and they're ready to fight this thing. They're just trying to keep safe.
Now, Matava, one of the measures that the government has tried to deploy, or rather it has deployed in combating this COVID-19 issue, is introducing a dusk to dawn curfew. Matava, do you think it's working? Is it containing the virus? Is it working?
As I was saying, now being the first day when curfew was enacted in Kenya, we had so very many cases of people not following the rules, and they were found themselves in the wrong side of the law. So, Abel, I would think so far, the government says that the COVID-19, the virus travels it's so more active at the night compared to the day. So we need to follow the directive, what the government says, and make sure that we keep the measures as they say, and not to get outside during the 7 p.m. That duration at night, because they say it is active that time, right? So I think we should follow that directive and see if it's going to work, because the government thinks it's right and it's going to fight this COVID-19.
Our law enforcers, I'm talking about our police, they brutally harassed people, they beat people, including women and elderly, the elderly in our society. Do you think that was necessary?
I think I'll first want to condemn that action, police brutality. It's something against humanity and human rights. And this pandemic is not a protest kind of thing. It's just something that is hitting us and no one is familiar with. I think people should have been handled with care from the first day. Our police service has a reputation of using excessive force even when it's not necessary, and I think this matter should be taken up with by IPOA. After the first day, things quite smoothened out. I think they just get us a tinge of authority and they want to misuse it, and that's not a good thing, Abel. But on that note, I wanna lay in a few ideas about the curfew. Uh, you know, I didn't quite get the sense of that curfew. Of It is a good action, but it isn't as effective as it should have. It should be, considering at the night is when most people retreat to their homes. So that that curfew really didn't make sense. I think what it should have been, it's like Germany. There's a regulation that a maximum of one person per household can go out and get maybe supplies and stuff. It's not a lockdown, but it's an action. The number of people in the streets. So if they had gone in that measure and said that during this period we only need a person from a household out, because at night is when we all come back at home to like stay with our family. So hence I feel the unnecessity of that curfew in the evening. Yeah.
Now, John Matava, President Uhuru Kenyatta, the other day announced that there will be no entering or exiting the 4 one-seat counties, that is the capital, Nairobi City, and also Mombasa County, Kilifi, and Kwale, respectively. Now, that directive was issued and it was to be effected immediately that day at 7 p.m. Motorists were stranded. Do you think that was the right way that the president took to deploy this method?
Okay, Abel, on my take, I would say I can't blame the president. I can't blame him. I can't blame him because coming up with that idea, they were in a cabinet and they saw it wise to do that. But one thing I would like to put across is that they never gave the citizens the time to make sure that they prepare themselves for the curfew. So for the lockdown. So I think the government should have spent more time educating us on what they're going to instruct us to do in the next maybe few days. So I think they should have given a notice and an advance before the instructor, and they put the measures into law to make sure that the lockdown is enacted.
Alan, were the citizens given ample time to come in or get out of the city, including the coastal counties?
For me, I think I'll have to concur with Matava on the issue of notice and preparedness. I think when the numbers were rising, we all anticipated a curfew, and most people are calling for that, or for a lockdown rather. And I'll like to correct you again. We are not yet on a lockdown. We're just a few stricter measures, because that's not a lockdown. A lockdown is way stricter, and I think as a nation, you're not ready for a lockdown because it's a big step, and it depends on how people react to the stringent measures added onto this. And I think people are not taking it as much as it should have been responded to, because we didn't need a notice. We always knew that every single day we'll get an update on this thing, and anyway, either way, we just as a nation have to be safe. And I think it was a good move by the government, because these are the epicenters of this disease, and if we try to minimize movements in these areas, then we are trying to minimize the spread to other counties. And I'll dread the day that it rural counties, because if the capital city is not able to combat this, what about the rural counties? So let's just see how these stringent measures apply and work.
Our frontline soldiers, that is our doctors and nurses, have they been equipped with enough PPEs, that is personal protective equipment? Have they been equipped enough so that they can conduct their duties?
Okay, Abel, first I would say I couldn't just say, just for instance, like Kenyatta National Hospital, let's take that for example. I wouldn't say the guys are not having, are not being equipped with the essential equipments to make sure that they fight this COVID-19. But now, Abel, now considering some counties, you find like a county like Makueni, they are having their own governor, maybe bringing out, for example, the other day, Kivuta Kibwana, the governor for Makueni, he said that he's going to add like 5,000 or 10,000 to the salaries of those doctors, and even improve on their kits for the testing of the COVID-19. But now, Abel, we can say it is something which is being done all over the country, because we've seen those are some of the counties that have taken such measures. So we cannot say maybe another county they have done the same, and so far we've not heard any other county hearing of they have done this as they have done in Mombasa. Governor Joe, what the measures he has put in place to make sure they combat the COVID-19. So, Habel, I would say not all counties are well equipped in covering or rather in fighting the COVID-19, but the government has a whole nation. I think it's the main task to make sure that every county they have the best well measures to keep the COVID-19 matter under control.
And the president issued that our artists should be given 100 million to entertain Kenyans amidst this pandemic. What about our doctors and nurses? Do they have that enough number of PPEs to conduct their duties?
First, about the nurses, I'll need to go back to the medical service. I feel as a nation, we will have done better because it took, from the time it burst out in Wuhan to the spread across the world, and that by the time Kenya was starting to get ready for it, I think we would have done better in preparedness. Remember, at the beginning, we had 12 quarantine beds. Remember, just 12. And then they were like, the government said that this will change along the way. And then the nurses came up and complained that nothing has been, no prior education to this. And yes, we understand it's a new virus, but there's a way to just be ready for these things, preparedness and education. And I feel that the nurses, the medical force is not wasn't rather being supplied with sufficient supplies and protection for the PPEs and whatever's, it was just as ignorant as before until the first situation turned out, and then it grew over the days, and then now the government knew how serious it was. That when we saw even the isolation facilities increase, and I think the move to just encourage every county to set aside isolation centers is a good move, because we never know how far this thing can go unless we really consider the measures being put by the government. And either way, it still is a good point to be ready, just a preparedness level within the counties. You see now, as a nation, we have over 65,000 beds and a capacity for, in case this thing gets out of order. Sorry. On the artist thing, I think this is a long overdue reward they really needed. It's just that it came at the wrong time, but it's something they really deserved from the beginning. I remember when the president was giving an address on this, he started by saying these are implementations that he was making from last year that he had discussed earlier this year before this pandemic hit our country. And I think it's a good thing, but only the problem comes in on the framework of which they disseminate this money, because I mean, even us are artists, when we start spreading out memes, that's being an artist, and we are trying to entertain our fellow citizens. But which measures do they have or a framework to gauge and classify these artists into a group of maybe musicians, art painters? We need a framework on how to know this money will reach all the artists, because the people who need the money, and the people who really don't.
However, artists being given 100 billion shillings as their reward to entertain when is this pandemic, when doctors are crying, are caring for their lives, that they don't have enough beers. enact their duties.
Abel, now considering the tough times, I think that's a misplaced, it's a misplaced priority. Now, just look at it how it is. 100 million being issued to artists to entertain the citizens, and we're not hearing maybe like 10 billion is given to the nurses to maybe improve maybe their salaries or improve their protective gears in the country, or even supply. Before I just go to much deeper details, I heard the government just brought in more than, I don't know, it's 5,000 liters of sanitizer, but some places we haven't seen that. We haven't seen that. We've been told all over the media they've said they have issued the number of liters of the sanitizers to the citizens, but we haven't seen that. So I think the government there actually they didn't consider what people are really facing at this time by giving 100 million to artists just only to entertain people. I think that's so ironical. It's so ironical.
Now, gentlemen, the latest directive by the government is that here in Nairobi CBD, you cannot walk freely without a mask. And keeping in mind that Kenyans live from hand to mouth, as in they cannot afford that the N95 type of mask, which I'm being told it's 1,500 shillings. Is it the right way to go? Should Kenyans be arrested because of not having a mask, Alan?
No, I don't think that should happen. Uh, First, before I talk on the masks, let's go back to the artists. I feel as much as it was a needed reward, it's really unnecessary. It's a misplaced priority. I mean, that money could have been used to maybe service those families that live hand to mouth to get a daily food on their table. You know, that's why there's a problem in implementing the curfew issues, because people are trying to just get out there and get food for that day. So I think rather than giving that to the musicians, it should have been given out to the families that live under $1 a day or something, or just find a system of trying to feed the people who can't get something to eat. And now on the masks, back to the masks, I feel at first we didn't have enough or didn't even consider it as a big deal. Remember at first when we were still under 10 cases, the CS said we really don't need masks if you're not sick. Then when we hit around 100, he changed his narrative and if you really need these masks. And then you see the other day, we are being told in the city, if you go out in public without masks, you're being charged. You know, it just went from 0 to 100 very quick. And I think from the beginning, we really needed these masks, except the government didn't want to admit that because there was a shortage. And in case they had admitted that at first, there'll be a panic shopping and then we'll run out of them very fast. And people really need them. There are people who really needed them before, more than we do right now. So I think that was a good measure at first, not to give it to the public that they really need the masks. But now when they incorporated the country to like produce these masks, you see Kitui, there are different plants producing these masks. There's Kitui, the fabric industry in Kitui is producing masks, and then other companies have been given the quality go ahead to produce these things. I feel we now have the opportunity to get enough numbers of these masks, and I think it's just a no thing. You know, you just need a mask. It really helps you to prevent touching your face and stuff like that, and also the air you breathe, you never know what you're breathing. So it's a good measure that everyone should have a mask, and it's when you're having a mask, you're protecting the second person and yourself. It is just what it is. You just need that mask, and I'll say under this is people really need to be educated on how to put these masks on, because the other day when CS Matiang'i was moving around to check on the inter-county movements, I saw he was not putting that thing on the right way. Why would you put on a mask and leave out the nose? You know, you're supposed to cover your mouth and nose at the same time. So I think the government really should invest in education of the public, because most people are still confused and in the dark of this thing, considering the rural areas, and some people in the city as well don't really know how to move around with this mask issue. So we should be educated on how to put these things on, because that thing has a string. You don't even know where the string goes, if it's up or down. You know, the government should really consider on mass education with this issue.
Yeah, good point you have raised over there. Also, CS Matiangi should lead by example on how we can wear those kind of masks appropriately. Now, Matava, you cannot walk scot-free without a mask in the CBD. What is your take on that?
First, Habel, I would just like to add on what Alan just said. Checking, yeah, the masks, they are there. Now the price is going up to 100. The other day they were like 10 bob, 20 bob, but now it's 100 bob, right? So I would think when somebody is walking scot-free without a mask in town, they should face the directive. They should face the law, because already there we have already been told that the mask is going to do this and